And the Dream Bros are back. This is my friend and colleague, Darren Jakovic from Smithers, Canada. Hi, Jake. Welcome.
Hey,
This
Bill.
is Bill
Thank
from
you.
People of the Dream.
Wonderful. Good to be here again.
So you had this idea about talking about language. I don't know whether it was related to a question someone asked, but you had
It,
a quote
it
from
is
Sue.
somebody's. Yeah, there. Oh, yes, so among the things in this session I do want to talk about is language and how do we develop a language around things. And yeah, there's a whole bunch of other directions we wanted to go, but Michelle in England said she made links with what we were talking about. It's nice community building here. She said, made links with what we were talking about to the language of meditation and spiritual nourishment. And she says, I'll get back to you on this. Like, how do we develop a common language, which is huge for me and somebody who practices inner work and has a job in the outer world, which we all do in a way, but in the scientific community in particular, or in the medical community, how do I find a common language that's understandable to people to describe what it is that we're doing and that we can use to in both places. And I've really struggled within the emergency room or my clinical settings to use the language of what we have learned in what we do with dreams or inner journeys and apply it to both places in a way that is acceptable. Does that make sense? Are you?
That makes total sense. I mean, I think it's one of the challenges of working with dreams or dream work that, I mean, part of the whole ethos of what we do and part of the reason we love working with dreams, right, is about how personal it is and how individual it is. So how do you take that sort of individual experience and communicate that and communicate the commonality of it, which also exists?
Yes, it does. And there's this unique personal experience where somebody will get an epiphany, an insight uh, through dreams or through any other modality, and then try and communicate it. Oh, this reminds me of one of my after I first got a bunch of insights about myself. And it was about 3 months later, I had these profound insights as to why I do the things that I do. And I was trying to explain it to somebody. And I had this dream that ceramic words are coming out of my mouth and I'm smashing them with a baseball bat because none of the words seem to make sense. And one of the surgeons said to me, Jacob, you know, you sound nuts, right? It's like, okay, thanks for that insight.
This is
I
one of
really
your
was thankful.
dreams.
It's like, thank you. This, yeah, but the dream explained it better than anything else. And then he summarized it, not about that dream in particular, but I was trying to explain to him the insights that I was getting in a very rapid way through working with my dreams about how I was in my own way, but I wasn't communicating it well. And the surgeon summed it up. You sound nuts. It's like, great. Like we had a good relationship. And he's like, just to emphasize to me, I need more language. I need to speak of this inner work or insightful work and in just psychological and spiritual work and how it relates to your everyday world and your health and the maximizing of your relationships, et cetera, in a way that is more grounded. But it changes, and this is where I want to bring in the Sue quote because it changes over time and it changes for you. And the quote from Sue Scavo, who has taught me very much over the years and is wonderful. Sue said, every time you change, you need a new language for the place that you're in. And it's a wonderful quote. And I found it to be true. And it helps describe the struggle of, okay, I found this insight about how do we speak about dreams? How do we speak about inner journeys? But actually, I think about it differently today than I did yesterday. And that new language that needs to happen is a struggle and makes me it's hard to communicate what it is I'm trying to communicate. And I've found it with many other people doing self-reflective work, or they're trying to describe what they're going through or how they're growing or what they've learned, but it's really, really hard to put to words.
Yeah, you'll often say to me, I don't have words for it.
Yes.
So we hit a bit of a technical glitch, but we're back. And you were talking about how the language that we need evolves as we change.
Yes. And I don't have a language for that, Bill. But part of the reason to have these talks and to speak with you and to communicate with other people or have a community of people, which helps because other people give me insights and then I keep learning, is to help find this language and to have a better way of communicating with the broader community, which I think is good for me and I suspect might be good for other people as well, but I don't know.
No, I think it's super helpful because we were talking in the last video, I think, about isolation and dreams and how people in recurring dreams and how often they feel like they're alone. And I think language is a part of that. Like, if you don't have a language to communicate, how do you be with someone if you can't share your experience? I mean, obviously, there are certain ways you can be with people without the language, but it's so much a part of being with each other. The way you and I speak to each other is so much a part of our relationship. The way that Sue and I speak to each other is so much a part of our relationship. And in terms of like the broader community, like having a sense of community requires some kind of common language. So I think the first thing in relationship to what you're saying is to just do what you're doing, to acknowledge that we need actually to be learning how to have a language as opposed to just like accepting the language that we've been given, which honestly doesn't really work for the work that we're doing. Or maybe it does, but we have to learn. So even around the word love, or we were talking about fear and anger last time, like without a conversation about what fear and anger means to us in this work or in this practice or in this culture, whatever we want to call it, I could use the word anger and somebody could think I'm talking about abuse. I could say, well, I'm feeling angry, and someone might think I'm feeling violent. But if once you start to develop a common understanding of the language, then you can be with people in a whole different way. You can actually begin to I think creating language is part of creating culture. And I think we live in a culture that's very dissociated from any deeper experience of reality. We live in a culture that's all about not even really exploring. It's all about like I remember you and I talked about this once, I think, and I thought about how like we were taught vocabulary in school, or maybe you weren't, but here in the States, I was taught vocab. This word means this, which of course it's basic, it's fine. We all need to learn
Yes.
the basics of it. What Sue was talking about, Sue's a writer, she's a poet, she has a whole a dream worker. So she has a whole different when she talks about developing a language, she has a whole different relationship to words than most of us do. And I think that's a radical thing to do. I think it's why poets are so potentially radical because they're
Yes.
playing with language the way we play with dreams. They're playing with consciousness through words. I have stronger feelings about this than I realized.
It's good. Like when you started talking, I felt this sense of relief that I could stop talking about it because I didn't have words. And I so believe you about the poet thing. And I'm like, I went to university in the sciences and I was biased. And so are my scientific friends that, okay, the science is, this is the superior way. You do get this arrogance in my training, and then the older you get, you realize, okay, you get humbled over and over and over. And I just worked with a medical student yesterday in the operating room, and she was such a good communicator and was asking good questions and brought things together. And she let it slip that she didn't do a science degree. And it's like, oh, no wonder you can actually communicate. There's an increasing realization among the best of admissions to medical school that maybe people who've done something other than just science and that are actually can be better doctors and better communicators, and how much communication is a part of this. And I'm seeing it firsthand, even in some of the medical students that I work with. They come in training to our center, and I see them in the operating room or the emergency room, and I'm the mentor. The ones who can actually communicate. So to use our theme of language today, like you can actually navigate your way through a situation better. And if you only know science and scientific method, it's phenomenal, it's necessary, but this crossover of how do you use that language and actually communicate with people, or the whole thing about immunizations and like the miscommunication, the lack of communication is stunning. Oh my god, it's stunning how the scientific community at their best hasn't been able to stand up and just make a clear communication pattern about what is reasonable, what is not reasonable, what's the evidence, what's not evidence. It's nobody's fault. It's systemic fault, and it's how we've trained scientists, I think, at their worst. And the mediator between science and communication is just faltering, and it's coming to the surface in things like immunizations.
This
Yeah, yeah.
something? I saw this fascinating study in the States, at least, about people's skepticism about vaccines. And they said the number one indicator that someone would be a vaccine skeptic is whether they have a relationship with a doctor or not. So if you have a relationship with your doctor, that's a positive relationship with your doctor, you're far more likely to at least be open, even if you have questions about it. You're far less likely to at least have some kind of like openness to exploring it. Whereas if you don't have a relationship to your doctor, you're much more likely to have sort of a blanket opposition to it. And I thought that was an absolutely fascinating insight, really, because I think that's been, again, it's like a relationship thing. It's language, it's isolation, it's relationship, it's communication. Like if people don't have somebody to communicate with, to be in relationship with, then everything breaks down, including the science. I'm hearing part of what you're saying is that the scientific world also needs to incorporate a little bit more of a relational understanding of things. I mean, there is a part of science, and I think there's a part of reality that's object subject also. So you study, you do the facts, you do all of that. But even in the science world, there's an understanding now of how there's a relationship between object and subject, like the whole idea that that was completely separate, even in the scientific world. But I don't think, not just in the scientific world, but also in the culture in general, we haven't caught up with that understanding.
Yes. And I'd say, yeah, I appreciate the perspective. And two things come to mind here. One, I want to say something about vaccines in a moment, but the quality improvement movement, I mean, quality improvement, just those words, there's this community, and I didn't really understand it until I joined it. But a lot of it is how do we do small scale studies and communication patterns and bring things to light and communicate better and optimize systems in a way, really, it comes down to communication and language and relationships. The whole quality improvement movement that is, I went to a conference in Florida last, what was it? So last December, I guess, was the IHI big conference, and I presented my data on ketamine infusions for.
So this
But
is specifically quality improvement in the medical world that you're
this is,
speaking
but
about,
it
right?
goes beyond. But yeah, it's the medical world has embraced it, and even a lot of administrative parts of it, and the medical. So it's one of those in between that people who are running the systems and the people on the ground can agree. Okay, how do we use quality improvement, this methodology, in order to find a common language to make it so we actually communicate better and we improve our systems better, other than so it's separate from research, which you have a set of goals, defines a hypothesis, does this immunization work, for example. So it's separate, it's more of a
Yeah.
communication and relational and systemic look at the whole system. So people know there's a need, and quality improvement, one modality that people have embraced that hopefully gives hope to say, how do we bring together parties to communicate better? Things like, just to use the example of immunizations. And like one of the things, if I could just speak as a medical doctor to say, then I think would be a relief to people, and the system doesn't say it, is like some immunizations are way better than others. And that's okay to say. Like it's humility. We could use some humility. Like the pertussis
Right.
vaccine is moderately effective, but it's not nearly as effective as the measles vaccine. And the measles can be way more nasty. And,
And there's real risk with vaccines.
right.
That's another
And
thing. It's not like there's no risks at all.
right. There's real, but in which point the polio vaccine, amazingly effective, but then the oral one had more, like some side effects from the injectable and the oral, and okay, the side effect profile, we actually caused some harm here, and where is the harm versus the benefit? And like most things in life, if you have this dialogue, but you hear on the media, go get the COVID vaccine, it's like people put their hackles up. Well, as COVID became less infective and less virulent, it caused less damage to people. Probably the vaccines, it wasn't as relevant as it was early on. And we can just say that out loud, right? Well,
Well, and it matters greatly someone's age also, right? Like,
totally,
so if you're a
totally.
young person, it's a totally different thing than if you're 70 years old.
But early in the disease, when COVID was really nasty, it was affecting young people too. So, but then it became the virus evolved, and then suddenly it wasn't. So if it evolves again into something particularly virulent and nasty, well, then suddenly that vaccine is way more relevant to young people, old people, everybody. But our communication patterns didn't match that. within the medical profession. And people, if you're mistrust authority figures or have had negative experiences with the healthcare or any
Like
top down person.
who hasn't?
Right, right. And so you like, you must get the COVID vaccine. It was no wonder people would say, like, there'd be this, like, somewhat expected backlash. And then there was, like, the fear of lawyers, I think. Like, we couldn't tell how many people were sick with COVID in our hospital just for confidentiality reasons. But so people did, we didn't talk about it, so people didn't know there was actually people sick because we're afraid of lawyers and somebody suing. And so like, so you people didn't speak almost for fear of lawyers. So you didn't speak the truth of what was really going on in the hospital, but yet we need to speak the truth. And why are we so afraid of just speaking the truth? Like, who's going to get mad? Who's going to sue you? But it was this crazy lack of communication that I saw from my perspective. This is in my little bubble of so I can't speak for everywhere. Yeah, I feel even now it's funny just saying what I just said. It's like, Jacob, you're not a public health official. You're not allowed to speak of these things. Like, I work in the emergency room, and as an anesthetist, I would kind of have this crossover to the internal medicine and resuscitation department. So I can speak of it from where I came and my experience of it and talking to other community members and communication. Okay, now I feel like I'm running out of words, Bill. I don't have the. Here's another one. Before I do, it reminds me of Carl Jung. There's this quote from Carl Jung. Can I make? I love this. I love this quote. I think is this from the Red Book? But it's worth saying. I have to read it here. So Carl Jung says, "Be glad that you can recognize it, for you will thus avoid becoming its victim. Madness is a special form of spirit and clings to all teachings and philosophies, but even more to daily life, since life itself is full of craziness and at bottom utterly illogical. Man strives toward reason only so that he can make rules for himself. Life itself has no rules. That is its mystery and unknown law. What you call knowledge is an attempt to impose something comprehensible on life." And then he says, "Soul spoke to me in a whisper, urgently and alarmingly. Words, words, do not make too many words. Be silent and listen. Have you recognized your madness, and do you admit it?" There's so much there, but just the fact that sometimes when you put words, for me, it resonates. When you try and put words to things, sometimes they just don't add up. And it's like, did I say something that sounds crazy? Or does even the point of having this little podcast here, this YouTube, for me is to try is matches a bit of this quote. I can relate to Carl Jung because when you go into your dreams, you feel completely mad sometimes. Like, have I completely lost it? Is this the reality I'm in? What sort of a nightmare is this? And then you try and put words to it, and him saying, like, just stop making the words. The words don't make sense. Anyway, that's a bit of what I take away from that.
Yeah. I mean, it's interesting the word madness, right? Because I think a lot about culture and the norms in our culture. And I think part of what he's talking about there about madness is just like, can we make space to step out of the norms of the culture? Can we make some space to create new language? We make space to do relationship. As long as we're honest about our certifications or lack thereof, like all of us can have our own opinions and communicate it and also try to get like, well, what's underneath that for you? What are those, like you talked about people who've had negative experience with the health system? Like, can we have a conversation about that? Rather than just sweeping it all under the rug. And it's like, no, just trust me this time. Can we talk about the abuses in the culture? Can we talk about the lack of care? I mean, there may be different issues here in the States, around the thing I said about like a lot of people just don't have doctors, like it's a struggle to get healthcare here sometimes. So I think the whole issue of madness and norms and language are very much related. And I want to segue back to dreams. That's the right word to use, speaking of words. But I want to link back to the idea of dreams where it gives us some space to play around with being what we would normally think is mad. Maybe we just have space to be like, maybe I don't like vaccines, or maybe I do like vaccines, or maybe I don't like vaccines because of this experience that I had. And is there space to actually it not being either I'm pro or anti-vaccine, when I have to have an opinion and it's black and white and the doctor knows better than I do, or I know better than the doctor because all doctors are whatever my experience with them is. Can we actually learn to be in relationship? And actually, the whole thing comes back to, can we get to know each other better again? I think our culture's become we've become dissociated inside ourselves, and we've become dissociated as a culture from each other. And can dreams be a venue where we learn that there can be multiple meanings and multiple levels of meaning within ourselves so that then when we're in communication with someone else, there's space to ask, what does that mean for you? I've referenced the
Smiling
visit with.
as you speak, I think the poets probably know exactly what you're saying, but yeah, keep going there. I hear you, Bill, I'm with you.
Yeah. Yeah, no, I think poetry makes space because it's madness, right? In that sense of like, we don't normally communicate through poetry. We're like, I have to explain to the listener here on YouTube exactly what I mean. And as opposed to like, which is nothing wrong with that. I think we should do that as best we can. But what gets left out of that more scientific part of the discussion is like part of like learning to communicate with people is sharing why these words, why these experiences mean what they mean for me. It makes me think of your question from Marlo. Like Marlo had this question about like how do dreams help us to understand ourselves? And what I love about that question is that, and I'm sort of jumping ahead of his question a little bit, but to the extent that they do help us to see ourselves, and just by the very nature of like we can actually see ourselves outside of ourselves in dreams. It's like seeing ourselves in a movie. They become such a playground for like, well, can I say a dream? I'm
Please.
doing my flowy thing. You may have to like help me structure this a little. But I had a dream the other night where I had this long, really beautiful blonde hair in the dream. And at a certain point in the dream, I had this thought of like, wait, I'm like old and bald, not completely bald, old and balding. And as soon as I had that thought, my appearance in the dream changed. It was like I couldn't handle the madness of having long blonde hair. I couldn't handle the beauty, the madness, to go back to your quote from Jung. And so to go to Marlo's question about like how do dreams help me to see myself? Like that's a moment of like, well, I mean, obviously, literally, I'm never gonna have long blonde hair. I never have long blonde hair, but like whatever that means for me, the youth of it, the beauty of it, maybe the femininity of it or gender fluidity of it, whatever that all means for me, what is it that makes me like suddenly be like, no, that's not who you are. This is the reality of who you are. And can I play around with like, well, but what if that's not totally true? What if I could be in the madness of, I mean, again, I know I'm never going to have long blonde hair, but like whatever that means for me metaphorically or spiritually or emotionally or however we talk about this, whatever words we use, whatever that feeling was for me, can I make space for that feeling? And can I also be even tender about the part of me that's like, no, that's not allowed. You're not allowed to be that person. And I think it's a great way to be inside. And I think the more that we can do that for ourselves, then it makes it easier to have a more fluid way of asking questions and listening to what other people have to say, which I think is ultimately what creates the common language. We have to speak in order to create a common language, right? We have to speak and be in.
Yeah.
Common language is created through conversation. Common language is really a form of intimacy. I'm speaking these words and then you're feeding them back to me or questioning me about them.
So can I ask what's often our favorite dream question? So in that dream, Bill, what was the feeling? And where in your body do you feel
I,
it? Is
I
the
knew
second
you were going
question.
to ask that. It went along with this other very tender moment where I put my head on another woman's shoulder. I said another woman. I think I was very like almost like a woman, or maybe I was a woman in the dream. And I put my head on this other woman's shoulder. So the feeling was very tender and soft. I have a male friend, another dream bro who I'm doing this like 100 days of softening. And I think it was like a moment of softening. Like, I think it was just like this soft and beautiful. I think although I have to say, the part I think that was hard for me, I think the part that triggered the like, no, you're old and balding was like, it was hard to let in how beautiful I looked. Like, I remember seeing myself in a mirror or something and thinking, wow, wow. And that, I think, that feeling of like, you look beautiful was, I think, the feeling. And this goes to Laura's thing, like, well, what do you do when you can't handle the feeling? I mean, I think she was probably maybe talking, but this may even be linked to really hard feelings for me. Yeah, it was hard for me to stay with that feeling of And I don't know that is that a feeling? You feel beautiful? Maybe there's a joy, a pleasure.
Totally. Totally. If I could just interject for a second, the like that, like in some more counseling traditions, like can you look in the mirror and say "I love you" and to yourself, sort of thing. That cliche. How enrolling, we talked about it the last time, just how hard people are on themselves. And I see it as a medical doctor. I see it in my own journey. We are incredibly hard on ourselves, or the people who are, or more arrogant and narcissist. It's like it's a show because you dig under the surface and they're actually incredibly hard on themselves. Just to see yourself as beautiful. I mean, it's even hard to talk about.
Yeah.
Right? There's this part of me that rebels, and working with my own dreams and other people's dreams, when something actually beautiful happens or there's beauty, it's amazing how hard it is to let that in. To me, I mentioned the Nietzsche quote before, and I think that's why that there's this part of us that is very reminds me of a lot of British humor of or Monty Python esque. This kind of there's humor in there, but it's easy to see what's going wrong in any moment, and sometimes only through humor can you see the beauty and the laughter in it all, and how hard it is for people to give themselves a compliment, to see beauty is often incredibly hard for people, myself included. Yeah, people have a hard time accepting compliments. They just do because it's
There's a language limitation there, right there. Like, so if we can't feel love for ourselves and others, if we can't feel beauty and compliments for ourselves and for others, think about how language limiting that is.
and dreams do to bring in dreams. Dreams have this way of challenging you. It's like it's suddenly in a dream you're
Especially when you
beautiful.
have a friend who will ask you challenging questions around the challenging
Yeah.
dream.
Yes, it's hard to be put on the spot with your dream. So kudos to you for doing it through YouTube here. But it is so incredibly common that people can let in the dark but not the light, to use rough terms. That oh my God, that it's
Are we going
and
to get
I'm no
into the
different
dark and light thing? I think it's hard to let in the dark too. Also, like I think we
for
let
sure.
in sort of a story about the dark, or we let in a story about the light. But to really let it in, like going back to like your dreams that you talked about, and maybe the first one about the abandonment stuff or the not being able to save people, like there's a darkness in there, at least in terms of the idea of pain, and I think whether it's beauty or pain, again, our culture keeps the language up on this outer world level of like, oh, they're pretty or they're not pretty or whatever it is, or this is bad or that's good. But very few people get underneath that to like, well, even the whole political discussion and how divided it's gotten here, particularly, again, maybe more so in the States, but I think it's happening everywhere. It's like, but why is that painful for you? What does that really mean for you? And why is it so important to you?
Right. And one beautiful thing and horrific thing about dreams, and this to bring in Beth's quote to tie into this, dreams will show you that in a way that's incredibly personal. So I can say to Bill, well, what is that for you? And like you'll come up with this intellectual answer. But dreams will show, like there's a 5-year-old in the dream walking into a library, and like I won't know, but you'll say, "Oh my God, when I was 5, I walked into a library and the librarian yelled at me." Or like there'll be this total what seems like a tangent story that can totally line up with why you have this behavior right now and why you're resistant to that. And as to quote my wife Beth, who she's like, I love when her and Sue play off each other. Like Beth can be absolutely brilliant working with dreams. She says, "No, I don't want to do that." Fair enough. It's like, but honey, you've got these great stories, and I've seen other women resonate to your journey. And there is something specific to the feminine journey and like that's different. That when her and Sue speak to it, it's like you can see people's eyes. They're just like, listen, and she tells her story, and it is so unique. And she said, one of the things that conventional therapy, just kind of quoting Beth here, conventional therapy never helped me understand why the things that I did, or it took a long time to understand why. And by that time left the therapist or whatever. But there's like the addictions or compulsions or behaviors that you have. But with dreams, oftentimes you see very quickly what it is, the event that caused the trigger, that caused this flow of events that let you bring these things into I cope in my way by this little addiction or this little compulsion. And the dreams will bring in this little side story that if you know how to ask the questions right, which is kind of what we've learned to do, they will find that story themselves and link it. in a way that I never could, or just talking won't. And I mean, all forms of reflective sort of therapies have this, like the play therapy, or the anything that brings something outside. But the dream, it's so incredibly, as you know, Bill, it's so incredibly specific to you. Or almost always, ages in dreams are important. Not always, but almost always. So you'll say, "Oh, well, there's a 7-year-old in the dream. What happened to you at age 7?" And people will look at you like you're some sort of a guru. It's like, I had no idea. You just told me there was a 7-year-old," and they'll say, and they'll go off in a side story. But it's amazing how often that's relevant. Not always, but often. That's like there's this story that links to why they're doing what they're doing now. And I'm thinking of a specific Beth story. I don't have her permission to share it, but it's like, "Honey, I want you to come onto this. I want you to tell a few of your dream stories, because they're profound," right? You can see the same thing about Sue. Maybe
Yeah.
one day we'll convince them, Bill.
Yeah. I don't know, do they need convincing? We probably just need to invite them.
Maybe Sue would. Yes. I have invited Beth. She said no right off the bat, but maybe Sue would.
I mean, can I? So here's a language thing. Can I reflect back a
Yeah,
language?
yeah, yeah.
So, like, when you talk about how we are with dreams, like, you often say, like, we know how to ask the right question.
Until we don't, but yes.
But I also like when you like ask me about the dream, it's not just that you ask the right question. It's that like I feel like I understand that you want to know me. So this is
Yes.
where the language and relationship, this is where the growth of language and the growth of communication and all comes from, is like, I trust you enough as a friend and a colleague to be here in front of God knows so many people, and for you to ask me a very personal question because I know that it's being asked with love. So this,
Right.
so this is an interesting thing because there's the science, right? Because the right question's important. Like, it's helpful. The way that you worded the question is important. That's the science part of it. But at the same time, you asked it with a kind of love, and we have a relationship that we share enough that, like, when you ask me, I'm not going to answer it intellectually. I'm going to take a breath. And again, this is a somatic piece for me. It's like, again, almost need to close my eyes and just be like, okay, well, what is that really like? And then I sheepishly talk about the beauty thing, which is a little hard for me to stay with. But you also said, like, it's hard for you to stay with. But we don't, this is why poetry is so helpful. Like, we don't understand how much language comes from here. We think language comes from here. I guess it's the relationship between the two, because the words are important, but where the words come from is the thing that dreams open up so beautifully. Or when you work with dreams with the kind of curiosity and respect and love that you work with dreams, that we all aspire to work with dreams. It's like, well, how is that for you? When you're talking about one of your military dreams or one of your bear dreams, or this dream for me around my sort of shyness or shame around beauty, like, it requires both. It requires like truly being with somebody in a way with their dreams. So it's like this multiple level of relationships because you're being with me. And again, this goes back to the thing what Laura asked about, like, how to be with feelings that are overwhelming. Well, part of it's like, it's on the simplest level, it's like you're one permission to have space from it, to just acknowledge, like, oh yeah, it's hard for me to be with the beauty. Like, I don't have to go into all that unworthiness or whatever that is for me. That's the first level, permission to, like, you only have to go as far. That's part of the love. You only have to go as far as you're comfortable going. But the other part of it is like, we all need somebody with us that we trust, the way that I trust you, that you can ask me about that. And I know, all my old experiences of being a child and being called a faggot, etc. Like, this dude's not going to body shame me. He's not going to faggot shame me. He's not going to go somewhere homophobic on me. He's not going to, like, this is someone who cares about me. And language and culture are created out of that kind of communication and that kind of learning how to be with each other.
If I could throw in non-judgment, you say love, but how to, I mean, the two would go
Non-judgment.
together to
Yeah.
go into. Yeah, I love what you're saying. I do want to get back to the Laura thing. I think it's such a great topic, that question. So could we loop back to that? The Been doing things like this, there's this cerebral aspect we've thought of, well, how do we label these things? We should talk about tooth falling out dreams. We should talk about baby dreams. We should talk about death and rebirth. But there's this cerebral talk. Like when I say, do I ask the right questions? I love this quote. from somebody who I worked with dreams for a while, and I've repeated this quote many times. It's like, how do you ask the right question? She said, about 70% of your questions, they just go nowhere. About 30%, you hit the nail on something. And then we actually go down somewhere, and it's a wonderful thing. Even though we've learned the right questions to ask about dreams, I love the rough. God knows what percentage it is. 70% of them are wrong, anyways. 30% goes somewhere, and it's not about the exact question about teeth falling out. It's not about the exact question. It's about the relationship underneath, and them trusting that I'm not judging in that question, and she's willing to go down the pathway of saying what this dream was for her, even if I got the question dead wrong. It's about like the intellectual question dead wrong. So people who want an absolute answer to the teeth falling out dream or this dream or that dream, you're often disappointed. But sometimes you're not. Sometimes it's like boom, it's like you just nailed it right there. You got the right question. So I'm very much with you. There's this question from the heart of, which I would argue the word I like best is non-judgment. Can I be experienced by the person I'm working with their dreams as non-judgmental? Sometimes the only way to do that, I would argue, is by going there too. Or the people that work with psychedelics, they like, the best way to know what's happening is for you to do it too, and realize how bloody terrifying and how nothing makes sense. And you speak from that place of opening up to the other way of communicating with things that isn't necessarily linear. But the science part of me wants it to be linear, and the medical doctor part of me wants it to be linear. I want a specific set of questions, or people say, "Oh, can you tell me like how you work with dreams?" And the number of times we've tried to set up a training program, and there is like within the Jungian tradition and like traditional, they have dreams as a big part of their training process. Like, so there is some formalized processes, but often what we do within our broader community of people that work with dreams that haven't specifically, or some people have, but most of us haven't specifically studied under Jungian traditional dream, right? We've looped around.
Consciously not studied that way.
Right, right. But yet here I am quoting Carl Jung. I mean, the relational aspect of it is by far more important. I'm with you. Questions are big, and the experience of knowing which questions to ask is big, but also being
Can
non-judgmental.
I keep gently
Yeah, yeah.
pushing you a little bit?
Yeah, yeah, yeah.
Because, I mean, again, I think this is the overlap between the science and the heart, maybe, or the science and the poetry of it, and the personal aspect of it. Because I think you're dodging a little bit what I'm saying when you say it's non judgmental, because it's not that that's not true. Like, I think you're very non judgmental. But I want you to think for a second, like, how many years of inner work. Like, it's not like we can write a book and say, oh, you have to be non judgmental. I mean, we should
Yes.
write that book. We should, that's a common language we should all share. But think about how many years of work that you have done and what that really means for you, Darren Jacobic, to show up in a non-judgmental way, which for me, I experience as my hand motions very like specific, very much as you showing up from your heart. So yes, it's non-judgmental. Like you're making a decision to not be judgmental, but you're also making a decision of like, no matter what question, it doesn't matter whether I'm right or wrong because I want to know this person. So if I ask a question and it misses the mark in some way, well, I'm going to listen. Well, how did I miss the mark? Because it's about getting to know that person. And I just kind of want to acknowledge you as a friend and colleague of like your gift to like not just be non-judgmental, which is an amazing gift. But I know the inner work that you've done. Again, however we define inner work, there's another language thing. But I
Yes.
know the amount of emotional. Hey, I'll words. I know the amount of emotional, personal, spiritual, relational work that you've done in yourself, in your marriage, with your friends, as a doctor, that it takes for you to show up that way that you're calling not judgmental.
Beyond words. Thank you, Bill.
I apparently have plenty of words for it.
That's very kind of you, and I thank you. It's like a compliment. I've trouble accepting that. Thank you. I think of the places where I'm still judging people in my world, but thank you. I do think sometimes I've put in my 10,000 hours. Even when I read, Carl Jung's Red Book, and I think he's got chapters Descent into Hell Part 1, and
Yeah.
then that's not enough, but then there's Descent into Hell Part 2, and I think I get it. And anybody with depression or like they get that, or these or Dante's the
Dante's
nine levels.
Inferno. Yeah.
Like I don't understand the specifics, but on some level, I get it. Like once you truly go into your dreams or into yourself, you see how both dark and light it is, and how we carry that, and we experience it inner and outer. And in a way, I'm cringing because this defies words, but most people who truly go into their dreams will see both dark and light. And just to choose two very, very awkward words, which is another topic for another session. I think we talked about doing what is dark and light, and it's terrifying to go there. And I think it's a reasonable, at the end of this, go back to the why, the Laura thing, like how far do you need to go? Oh, for God's sakes. If you don't want to go into this dream, that's just fine. If you don't like, if this nightmare is too much for you, that's just, for God, the last thing I want to do is push you into it. But just for them to acknowledge somebody had this incredibly difficult dream that's experienced as the word we call nightmare. We don't want to, but if you are able to share that, it's amazing how many times you can make it through. And if somebody shares that with you, and just that sharing experience helps them be with it, and they've moved through it in a way that's really difficult to put to words. But the last thing you want to do is push somebody through that.
Well, and to piggyback on what I was saying earlier about going only as far as you can, or also just like acknowledging it, like, and I guess this is another language. I guess we're in the language video. Like, what does it even mean to move through something? Like, we don't really know. Like, we used to have this idea of like, we had this magical idea like that. Oh, if you went far enough into the feeling, you would move through it, which meant you would come out the other side, and somehow there would be this healing, this liberation. Which it's not like that never happens. But all those dark parts of who we are, or experiences that we have, is maybe a better way to say it. For me, none of those experiences ever completely gone away. Like, I carry with them with me always. And can we again just understand it from a relational perspective? Like, how do we be in relationship in a way that works for us with these experiences that we've had? And just, I think in any given moment we get to decide like how. So even like with this dream that you were just working with me, like, how much do I go into the shame that's there? Like, feels like there's some shame there about whatever that feeling of beauty is in the dream. Like, how far do I go in there? I don't know. I could go there, right? I could go in the darker side of it. Like, where does that come from? Where did I learn that? We can go to all those places. Or we could be like, or you could just play around with being the blonde. Like, you have choices. This is again a language thing. It's like we actually have choices in how we are with whatever experience and feelings, to the extent that we can. I mean, sometimes we don't. Sometimes I was talking to a couple of people the other day in a class, and they were like, talking about being in the trenches, and they were in the outer world doing their work. And it's like, like, there's certain things we don't control. There's certain things that, like, situations, experiences we're in, we don't control. But when we're not in the trenches, we can decide like what kind of relationship we have, not just to our dreams, but to language, to community, to friends, to partners. Like, or even decides really the wrong word. We can play around with that. What does it look like for me when I'm denying that beauty? Like, how does that then play out when I'm with my partner, or with other people? When I'm denying my own beauty, then how much does that make it hard for me to lay what I said to you, that the thing that you called a compliment? Whereas when I'm in that place of being the blonde, it's so much easier for me to like see. Actually, I even as I was saying it, like, I'm like, oh, I'm like seeing the blonde part of Jake, or the beautiful part of Jake. I was transposing my dream onto you, not literally, but when I accept my own beauty, it's like, oh, he's calling it on judgment. That's like such a small part of what I experience when Jake's asking me those kinds of questions. That's a part of it. But that leaves out all of Jake's beauty. That leaves out all of Jake's big heart, which is what I experience.
And of course, I cringe when I hear that, which is how it works. Even I feel like going on a tangent of, is it okay if I tangent? So this
Like
whole
I
thing,
said
not just
before,
a tangent
there's
of,
no tangents for me.
it's kind of that, like when you talk the dark and light and playing with, like, what are we all doing? Like, where once you find a feeling in a dream, I remember I had a client who had this incredible epiphany, and I don't even know what the epiphany is. And they grabbed the door handle and they says, "Well, how do I leave this office?" And I had no idea what their epiphany was even. Like, it's, but like their reality had shifted so much that they didn't want to leave because the world had changed for them just working with this dream. The way they saw the world changed. And your word choice is big too. And you're absolutely right. We can choose to go out, and people say, well, you can choose to say this is a beautiful day. I get to go to work as opposed to I have to go to work, which Sarah said in the fitness. Thanks, Sarah. A fitness class the other day said, okay, you can, it's, these are easy words to say, but when you're caught in the depths of depression, and which I see a lot of people with this, it's hard to know you have choice. And I like this example of my own personal journey because, like, I'm a doctor with a license that has a job that goes to the hospital to do things, and I see people, but yet my nightmares were so incredible. It's like, how can this be? Actually, I would resist even having a wife. It's like Beth tolerates me at times. And there's children at home, a wife, a job, yet everything on the surface seemed functional. People could see my agitation level, but these nightmares were just so frequent and so common. And I met with dream people, and at some point it's like, this is craziness. This must be past life. And I got a hold of a past life regression therapist. He lives like closer to Vancouver and Mission. I flew him up to Smithers, put him up at
Wow, I didn't know
hotel
that. I didn't know
for,
that.
yeah, for I think did we 3 times. My wife, a couple neighbors, and some nurses came in, and I got regressed into past lives. And like, if any of that's true, it's like the stuff that comes out of your mouth when you get hypnotized. It's like, oh my God, is any of this? But like, as a kind of the overall arching point of my story is that madness that Carl Jung speaks about. It's like, I'm crazy. Like, I've got this outer world life that is functional all on the surface, but there's some inner life that was screaming nightmares at me constantly. It's like, how on earth? And I can't be the only one. Like, there's got to be more of us out there that have these like screaming nightmares. And I find out there's actually a lot of people that do. And I often do repeat the quote again that sometimes I think the depressed people are just the honest ones. Well, they're, my God, am I the only one that feels these like screaming nightmares coming through, and flashbacks? And you can use words like PTSD, or attribute it to this life, but sometimes you can't form a nice line of association. Like, okay, well, this person, well, I wasn't raped, I wasn't this, I wasn't this. Like, the why are these incredibly traumatic dreams bubbling to the surface? Well, maybe it's past life, because I got to sort this out. My head demands answers. Go into a past life, and like, it seemed to help give me a bit of perspective. If anything, it gave me way more questions than it did answers, and made me think maybe the whole thing is all true. Maybe past lives are true. And as the to his credit, the hypnotist said, like, maybe it's true, maybe it's not, but if you find some healing and solace in it, who cares? And it's a great quote. I love that he
Yeah.
treated things this way, but he has seen some incredible healing by regressing people into past lives. And unapologetically, you'll say, go to a moment where this shows this trauma, go to the moment where you died. And it's incredible the things that come out of your mouth. We had this dinner party afterwards, and then we just never talked about it again because it's just too, it's mad. It's like madness. It's like Carl Jung said, can you acknowledge your madness? Do you admit it? And okay, how about if I just go to my day job and let's not talk about this, and I'll go back to the world of science where things actually tangibly make sense to me. But I feel like I've got, if I don't tell my story, it's like, you know what, you can actually hold a day job and have incredible nightmares. And how can I help other people be with incredibly difficult subject matter that's bubbling up within them, yet still have a day job and a marriage and raise kids and do the best they can? And I don't know the answer, but I know I experience that it's true. And if I just speak that truth and other people speak that truth, we can form a language around it. And that doesn't need to be so loaded. Where you use the word loaded, what was the term we like? Emotionally, what was emotionally intense, I think, is what Laura had said. Like, how do we be with the emotional intensity? Or have this moment of like, are you allowed to tell that story, Jacob Eck? You are, Matt.
I mean, can I talk a little bit?
Yeah, yes.
I mean, it's
Please.
not really a response, it's more like what it brings up for me. I mean, I think there's 2 things, like, I don't I mean, I we don't know what we've internalized from even in our own lineage, past life lineage, or, like, we just don't know what we carry. There's even some science on what's carried from generation to generation. But, I think part of the language is making space for people's experiences. There's a trauma writing, a woman. Judith Herman, is it? I hope I'll put her name down. I'll correct myself in the video description. And I think she's the one who talked about this point in Freud's work where he was experiencing all these women coming to him that had been sexually abused. And he got to a certain point that he couldn't, it seemed mad to him because we live in this culture where people deny people's experiences. So he got to a certain point, he went down this road of like, he wrote for a while about the amount of abuse that was happening in the culture. And according to Judith Herman, he got blowback from other psychologists and other, because it's like, it was like a Me Too kind of moment. Like, all you're being funded by people that you're getting very close to accuse of being accusing of abuse. And I think one of the things that's challenging is to realize that it's not us that's crazy, that the norm of this culture tolerates a level of abuse that, like, from a child's perspective, particularly, like, if you think of it metaphorically, again, even if somebody wasn't physically or sexually abused, and so many more people are physically and sexually and emotionally abused than we talk about, but let's take that percentage of the population and you think of the spectrum of people. So that's one spectrum of abuse. You think of the spectrum between that and the number of people that had what they needed as children, which is the other end of the spectrum. And I think it's very easy to begin. It's hard to let in. I mean, I have empathy toward Freud, although it's disappointing because then he completely backed away from what he was writing about, much to, I think, our culture and society's loss and his own personal loss, because I think he then went down all these other roads to kind of manage around what he was seeing. But I think it's not so crazy to just be like, people are hurt. More people are hurt than we're willing to talk about. It's like people talk about it on a story level all the time. Like sometimes I joke about how really in the States, liberals and conservatives, they agree on one thing, that things are messed up. But
Yes.
everybody puts it of like, this is messed up over here. But nobody's willing to say, I'm sensitive to that hurt that I experience out there in part because of the hurt that I've experienced. And again, how do you create a language when, as a culture, we're taught to deny reality? We're taught to
Yes.
like, you don't go there. And so, like, I
There's
think in our
I'm
own
I'm
dream,
so with you. I'm so with you. Sorry, carry on. I got a follow-up. Sorry,
yeah, I think in
keep
our own
going.
dream work community, our former teachers started to make it all about past lives for the same reason that Freud went away from his theories around sexual abuse that he was witnessing. Instead of just trusting the women in front of him, he went down this whole other road and went into all the Oedipal stuff and started to basically say they were making it up. And it seems like madness, but really it's, when you really get to know people, like, who do we know that isn't hurt in some way? And can we create a language of non-judgment, to use your language, and love of like, how do we learn to be with each other in all that hurt at the same time that we celebrate joy and beauty? Like, how do we do it in a way that we don't drown in all the hurt so that it doesn't become darkness? But we need a language. We need to be able to talk to each other about what's actually happening for us.
Right. I wanna pause you. I just wanna say that was beautifully said. I
Thank you.
completely agree. How's that for a compliment? That
But yeah, I'm letting that in. I am letting that in. Like, this is a great example of like having the dream last night. Like, I can practice letting in that, like, you're seeing a beauty in what I'm saying. I can let in that it's not, that beauty isn't the thing I normally think of it as. It's just like when people learn to truly be in themselves and be with each other, it is beautiful. It's also how we create beauty.
But we in the medical profession will label that as a disability, and I've had
Wow.
two
Wow.
people I know that have been put off, "Oh, you've got PTSD, you're, like, Canada you've got a Canada pension for disability." There's 2 people I know that have done enough inner work that have been angry at this and said, "I wanna get off of disability because, sure, I've had some version of post-traumatic stress disorder, but that doesn't mean I'm disabled. Like, for this period of time, I was unemployable perhaps, but it doesn't define me, and, like, as a metaphor, inner and outer, I am not disabled. I'm somebody who's been hurt, to choose your word. Like, just because I've been hurt doesn't mean I'm disabled. Like, in fact, the opposite can be true. You can be even more resilient if you get up, you can be like get beyond it. But we, as the medical profession, I think enough, I dare I say, there's enough people who don't acknowledge how you can be both hurt and functional at the same time, because there's a ton of hurt out there. How do we?
That's
And then we,
madness,
if
Jake.
that's madness. But if we label it as, and there's an entire like a number of books on this, and from the pharmaceutical industry and the diagnostic and statistical manual, the DSM within psychiatry, like we're good at labeling people, but that label, and then we've got, it's like the form, it's helpful to know where to put people, but at its worst, people can take on that label, see a disability from it, see how they're a deficit because of it, and live like not to their full potential and see it as a disease, and they have to take this pill for the disease. And like there's a level of truth that this pill might actually help, but there's the psychological aspect of there's actually something wrong with me because I've been hurt, as opposed to empowering a person to be with that and move, to use the words, awkward words, move through it in a way that they're able to be with it in a different way, and take away the term disability. And for, yes, this period of time, it was completely overwhelming for me and I couldn't work, but I'm not disabled for life because of this.
Well, because again, language is personal. Depends on the person whether that experience is disabling for them and whether they can
Right.
move through it or not. Well, the more we make it okay to be disabled, the more it is also okay to not be disabled.
Right.
But again, we don't talk about either. We don't talk about either. We have a great situation here in Maine where there's this vet. Running for Senate, and he didn't know whether he still considers himself disabled or not, but he experienced PTSD disability and got disability benefits. And he gave a speech the other night about what a difference it made that he had support to be with that, and what a life he was able to build because one, it was okay for him to be disabled. And we're so afraid if we take care of people that they're going to like collapse into that being taken care of. And he's like, no, like when you genuinely take care of people, then they become the best version of who they are. There's a new language for you. That's like not a language that people talk about here in the States, that if we love people enough, they would rise to their best. We think, oh, people only rise to their best if we drive them harder,
Are
if
you
we
allowed to
judge
say this,
them.
Bill?
I just did. God hasn't struck me with lightning yet.
Careful.
Yeah, I appreciate what you're saying about the fear. I love actually that but see, again, there's language, there's words. We're using words to describe why we don't talk about these things. This is why this candidate's so inspiring to me. It's because like he just said what? He's like so real. He's like this oyster fisherman, and he's like rough and like kind of another. He's like a bro guy, and but he's so, I don't know. He's developing a different language. He's like role modeling what you're talking about. We're role modeling, even what you just said about, are we allowed to talk? Are we allowed to have words for this? If you're okay with me reframing what you said, but in a way, what you're saying is, are we allowed to have words for this? And a lot of people are taught that they're not. They're taught like, no, don't go there.
Well said. It's
Thank
true.
you.
I agree with you.
So, you have any closing thoughts? I am aware that I have a session in 5 minutes.
Yes. I
We're
think
a little
this
tighter
is,
scheduled today than we normally are because we tried to fit this in both our schedule a little tighter than
yes.
usual.
But thank you. This has been, yeah, you've had some profound words, Bill. So thank you. That's my closing.
Thank you. I think we're good dream bros. I think we do this well.
Okay, sign out. This is too much. Too much.
Yeah, it's a lot.
It's a lot.
Are you good to wind down here? Okay. Good to be with you. Until next
Good to be
time,
with
and
you, Bill.
for everybody out there, thank you for being here. If you have questions, keep sending them to us. I think we got a whole bunch of them in today. Put them in the comments. That would help us if you're willing to do that. I understand that's shy. It takes a certain courage to do that. But if you can put it in the comments, that would help us with the algorithm. Like, share, subscribe if you're willing and it works for you. Yeah, until next time. We'll see you soon, hopefully. Bye, Jake. Bye, everybody.
Bye, Bill.